So why this course matters, first of all, the global burden of rabies in countries where we have a lot of vulnerable population also. And India's burden of the global human rabies death is about a third. India is rabies endemic, and this is from this International Rabies Task Force. So this is global data. And before I go here, sorry, in the course materials, you will see a number of 59,000 human rabies deaths globally per year, and a number of 18,000 to 20,000 in India per year. This figure, it comes directly from estimates from the World Health Organization and is based on all kinds of models and also data collection, but it is dated back to 2005. So that is really important to note, because in the media, these 20-year-old data, especially now lately when it was so often in the media, even the Supreme Court, this article here also quotes the Supreme Court, right? The data of 20,000 people dying per year of rabies in India is 20 years old, okay? It's important to know that. Did anyone do some research on this? Do you have other data? Did you find anything? And otherwise, we can
have the statistics, but I did go through the process of how the cases of rabies should be registered. I mean, I went through that module, but I don't have the statistics of.
Okay. No, I mean, just research. If you can just beyond GARC, just look at other sources and see if you can maybe find some more data, because there's a lot of data going around and none of the data sets are complete, or, you know, they all have some kind of a, you know, assumptions in it. And so it's always nice to compare data sets and have a little discussion on that if you really wanted to understand the size of the problem. So let's go and look into this a little bit deeper. So this is what the media is often quoting. These data are about 5 years old, 2021, and they're global data estimates. So they're not exactly, you know, the exact count. Nobody has the exact counts, but estimated data here in 2021 was that globally not 59,000, but 67,000 deaths. That's even a bit more. Then if you look at India here on the bottom, I don't know if you can see it, but on the top I set the number. India was estimated to range of deadly human rabies deaths per year between 2,037 and 3,565. Now that's significantly less than 20,000 per year, right? We don't know if these data are accurate, 100%, but if you would look at per capita data rates in India, as per these data, it doesn't even show up in the statistics. It's 0, which is 0.0 something, right? Per 100,000. I'm not saying that it's not a risk, okay? I'm just saying that the ratio on the population is less than 1 per 100,000. And so the other thing that I want you to understand also, you probably know about this because I'm talking to the choir here. You are all quite experienced, but I just wanted to highlight that the good news is that the human rabies death trend shows a 75% decline in India since that World Health Organization report was out. So in Delhi, we even had 0 cases in the years in which they had measured the data from the hospitals, 22 to 24. 25 is not yet out. There has been a study, the Lancet Infectious Disease Study, and that is a study by the Indian Council of Medical Research, specifically the National Institute of Epidemiology in India. It's published in 2025 based on data 22-23, and it is giving this number. Like, there is always insecurity, so they give a range. Say nearly 4,000 to like over 7,000. That's still less than the 20,000 that we hear and see in the media. right? So the number of 5,700 comes from this Lancet infectious disease study of the government itself. And the director of this institute had mentioned that 75% reduction trends. So this is the most recent data that we have. This was published in July last year, just before the Supreme Court came out with the Suomoto case. And just for Delhi, I have the data here, 000. So I am not going to ridicule the severity of rabies as a zoonotic disease. It is endemic, it is around, it is deadly. If the symptoms occur, there is no cure. But it is preventable, first of all. Even if you are in touch with the virus, you can still make sure you don't fall sick and you won't die. If you do the right things, and we'll learn about that, how we can educate people on doing that. But putting it into perspective, this is the picture. Even if you compare it with snake bites, even if you compare it with traffic accidents, we are really talking about, as I said, less than one person on 100,000, on 1 lakh. It is basically snake bites 10 times higher, traffic incidents 34, nearly 35 times higher. I, again, don't want to ridicule, but I just wanted to put it in perspective. What are we talking about, right? And the fact that we need to take it serious, there are programs that are working on it. Why do we have a 75% decline? Because we have strategies in place. Now, we know all that these strategies and policies are not implemented properly, and a lot needs to be done. And that is the positive of the Supreme Court order also, that the authorities now have been pulled up to do their animal birth control and mass vaccinations, etc. So India has a third of the burden of the rabies deaths in the world. India also has a program called the National Rabies Control Program, by the National Center of Disease Control, the NAPRE, National Action Plan for Dog-Mediated Rabies Elimination. By 2030, it should be 0 rabies deaths. I just wanted to say that these strategies, as you all know, just to add to this, the real effective ways of tackling rabies is not to cull, kill, relocate, remove the street dogs. But this program also has a multi-pronged approach. It also has the human protection, the human vaccination. It also has the dog, animal birth control, and dog vaccinations, mass anti-rabies vaccinations for dogs. The purpose of the program is basically not to eliminate dogs, but to eliminate rabies. I think that's a sentence that you also need to keep in your head. We don't need to eliminate street dogs. We need to eliminate rabies, right? And the tactic for that is not to remove the dogs, because then even rabies can come faster through monkeys, through rats, through other animals to us. These dogs are also like a buffer around us, right? So we get to all of that, and most of you probably already know. But we need to stabilize and immunize the street dog population. That's what this program wants to do. It wants to stabilize and immunize the community dogs. Good, so the program is there, the governments and the authorities are now being pulled up by the Supreme Court. What can be the impact of just one? You wonder, what can I do, right? What can be the impact of one educated caregiver or even an active local community? Well, you can at least achieve local herd immunity. What is local herd immunity? By vaccinating the dogs. Herd immunity, we'll get to it, has a percentage. What we do in stray buddy communities is we map these dogs on a tool on the website. These are all the communities. So you can look on the website. It is public website. It's straybuddy.in. And then you go to community section and you'll see all the communities here. Some of them are due, but we are going to do a big vaccination drive in the coming months. But yeah, this is just basically information for people who are not taking care of the dogs. This is information for residents' welfare associations or residents, your neighbors, anyone. This link is a public link. They can see in Saket H block. Of course, we have only 10 dogs. It's not a big population. People sometimes think we have 100 dogs or 50 dogs. And we have mapped them all. We know them by name. And we have records for each of them. This is a dog I take care of, by the way. We have these QR codes. We print them also on the collars with the name of the dog in the area. You can see the state is sterilized, rabies is up to date. It does need to go again, right, for rabies quite soon, like in a month's time, it's due again. So we can see, we can update all these data, and it's also a care, basically a record. If we have shared care, we sometimes over vaccinate or double vaccinate or over medicate dogs. So this is also a care sharing tool. It's an information tool as well as a care sharing tool. So yeah, sorry, that was also a little bit of promotion, but this is free. So if anyone in your locality wants to, and you have a team of local people for the local dogs, you can use this tool. Okay, so anybody can onboard on this website.